Hi, my name is Darren Chana. I'm here with Robert Shanks, my colleague from Spine Plus. We're just having a little review of some MRI scans. And as you can see, this is a lady, 61 years of age. She presented in clinic with lower back pain. And I believe she had left-sided leg symptoms, sort of back of the calf, sole of the foot, etc. And again, if you look on sagittal view, you can see that there's a little bit of a what looks like a high intensity zone, possible tear, annular tear at that level. But everything else doesn't look too bad. And as we scroll through, what you see on this little view here is an area, a little white patch just around the sort of facet interspinous level. So we're going to go over to the axial view, see what's going on at that level. Just minimise this a little bit. Let's do that one more time. There we go. That looks good. So as we start to scroll down, what you'll start to see is, for those of you who are not accustomed to these pictures, you've got the disc here and you've got the facet joints. They look nice and healthy, nice white hyaline cartilage, lots of fluid between, and the central spinal canal. And what you'll notice here, this was a lady, by the way, who'd been to see various practitioners, therapists. She'd had multiple sessions with what she said was lots of ultrasound of her lower back, and she wasn't really making good gains. So we had an MRI done, and as you can see from this view here, just at the edge of this facet joint, you'll see that there's this little white bubble exiting the facet, and it's basically a synovial cyst, which is encroaching within the sort of lateral recess or posterior aspect of the canal. And on the right side here, you'll see this little grey blob, which is the S1 nerve root, and you'll see equally the S1 nerve root here. But when you're looking at it in this view, you can see this little sort of bubble-like cyst is actually squashing into the sort of posterior part of the root, and hence causing some nerve root compression, and hence this is the problem.
It's a bit swollen, isn't it, that S1?
Yeah, a bit swollen due to the irritation and rubbing on that. So again, this is a clear indication why it's very important to get an MRI scan, because many therapists would maybe say there's no need because, you know, you find lots of little, you know, incidental findings in scans, but they don't necessarily cause the patient pain. But you can clearly see clinically...
Which is true, but like you say, you have to put it into clinical context, don't you, with the...
Exactly. And you would have expected this patient in clinic to maybe have some kind of discogenic problem, prolapse disc possibly, because when she bends, she finds that it's worse. When she extends, it's worse. But believe it or not, facets are in relatively good health. I mean, there is some general wear, but like I say, it's this cyst here. In terms of treatment, Robert, is there anything we could do? You would
what, treatment manual therapy wise? No, not really. Not with that cyst there. I mean, you know, treating around the area. But if we really thought that cyst was the one that was pressing on the joints, I mean, yeah, you could argue the point that, let's say there's some microinstability at that level, and there's some shearing going on that's maintaining that generation of extrasynovial fluid that's poking out into the area, then there's a need to address those factors. But really, I think first and foremost, the priority would be to get her out of pain and try and get that cyst reduced, and then look at the other, you know, factors that could have led to it in the first place. But really, get her out of pain first, and then try and...
And in terms of sort of trying to reduce her pain, I mean, something like this, I would actually recommend that the patient maybe have a root block of the S1 nerve root. We don't often recommend them, but an even possible sort of interlaminar steroid injection at this point.
Interlaminar rather than transforaminal?
Possibly. I mean, transforaminal, yes, because it's getting compressed, maybe anteriorly or the ventral part of it, but because it's posterior, there's a possibility that an interlaminar a steroid into that root may work that little bit better. But again, root block on the S1 would hopefully reduce her symptoms. And
would they try and aspirate that, Darren, and try and get the get that cyst reduced if they could get access to it?
It's quite hard to do. Again, they'd have to get in between the joint space and reduce some of the fluid by aspiration. The only other thing would be like a facetectomy to remove that facet itself.
But you wouldn't do that before you try the injection?
No, you would want to go through all the different levels first of intervention. But for me, it would be a root block, possible aspiration, and if that worked, I would even go as far as to say maybe do some radiofrequency of the root as well. That may work.
I think our colleague Dr. B would wouldn't he try and have a go at trying to
maybe
get that facet possibly
aspirate it down. But yeah, so again, another good patient that we saw, and where you can see manual therapy is not really going to be for them.
Yeah.
Okay, moving on, next one.